It is so important that we help educate pet owners on the importance of dental hygiene and dental evaluation that's done frequently. In this episode, we will be looking at an abnormal oral nasal fistula in this French bulldog. Because Frenchies are brachycephalic, the bone separating the tooth roots from the nasal cavity is very thin, especially around the upper canines and premolars. At Noah's Ark, we have a state-of-the-art X-ray, which is specific for dental, so we can pick these things up very, very quickly and very, very clearly.
This is Blue. She's an 8-year-old French bulldog here for her dental treatment today. What have you found, Dr. Sean?
Yeah, so she's because she's a French bulldog, she's got quite a crowded mouth, where the teeth, although you can't see it on this side because we've taken quite a few out already, but the teeth are all overlapping each other, and quite a few were diseased. So she is unfortunately only going to have one tooth remaining on this side, which is her upper canine. We've also found that due to the disease that she had, there is a communication between the mouth and the nasal cavity that may or may not heal up properly after this surgery today. But that would have been contributing problems. She's had a bit of discharge when she was under anaesthetic on the other side anyway. That was a bit mucky due to that. So yeah, we're just removing this lower mandibular canine here now. We've had to use a little hemostat here just to stop some of the bleeding. But yes, just a very large tooth, taking a little while. But hopefully she'll be a lot more comfortable after this today.
So, Doctor, you were explaining something to me just a moment ago.
Yeah, so we've turned over onto the other side of Blue here, and we're just tackling these teeth on the other side. And you can see that, that these premolars here are at a right angle to where they should be, and that's due to the overcrowding that happens in these brachycephalic breeds. So these teeth should be lined up along here, but they're currently lined up across the jaw, and that just means more likely to develop a level of infection and periodontal disease, which then therefore necessitates extraction, but it also makes the dental procedure itself more challenging because they're not in the areas that they should be.
Wow, that's incredible. And you were able to see concerns from the x-rays that you took earlier.
Yeah.
Did that give you an indicative...
Yeah, so you can see with these x-rays, for example, here, they're both of the lower jaw, and you can see these teeth at the right angles, and sometimes even almost horizontal rather than vertical, sitting in the mandible there, and you can see pockets of infection around the roots, and sometimes areas of furcation exposure as well, which is where this bifurcation of the roots happens in these premolar teeth. So yeah, some teeth to remove here, but also that overlapping and overcrowding makes it more challenging.
Doctor, your knowledge is incredible, and it really helps educate people out there. Nurse, how are things going?
Things are going good. Her blood pressure has dropped ever so slightly, not concerning though, so we're just giving her increasing her fluid rate, but she's got a lovely temperature, so yeah, all good.
Wonderful. I think most of us have all had some type of dental concern, and we know how painful it is, and we could tell people. Dogs can't tell you, and I think the importance of routine dental health checks is so important. The relief that this dog will have after this procedure would be remarkable. Please, please, please take your canine, feline, oral hygiene very, very seriously. We're available at Noah's Ark to help you. Please feel free to call the Noah's Ark team for any type of support that you might need. We have a state-of-the-art facility set in 55 acres. We also have paddocks that clients can use for running their dogs. And due to our historic ability to handle the more powerful working dogs, we specialize in that aspect.